Hello, dear patients and followers of our clinic. I'm Dr. Ahmedov, hair transplant surgeon from Smile Clinic, Istanbul, Turkey. Today, we are going to evaluate the case or the result of the case of the patient who underwent the hair transplantation surgery in our clinic in August of 2023. So it's almost 2 years after the surgery. This is a 33-year-old Asian male patient with the mixed type of the hair loss of normal type 5 in the front and the mid-scalp and normal type 6 in the crown area. Sometimes the hair loss type the patients present with may not be exactly the same what we see in the North Hamilton scale. The North Hamilton scale is a crucial aspect in the patient evaluation because it gives us the level or stage of the hair loss the patient has. And according to the level of the hair loss the patient has, the approximation of the number of the graft and treatment plan is mainly done. So this patient, as I told you, had a mixed type of the hair loss with neurotype 5 in the front and mid-scalp and neurotype 6 in the crown area. For this type of patients, just in all classic aspects, we most of the time require a two-step surgery. There can be different options for these type of patients. For example, the option number 1 and the most technically correct surgical approach, and as a long-term outcome, the option that make the patient the most happy with the result is the classic two-step surgery. When with the first surgery, we restore the front hairline, cover the front side, and reinforce the mid-scalp as much as we can. Because the reason for this one is that most of the time when people see you, most of the time they see you from the front side, and it's the front and the mid-scalp area. This most of the time is referred to as the front frame of the face or the head. So at least 60 to 70% of your final outlook is this area. So the patient had the normal type 5 to 6 as we mentioned, and on average for this type of patients we may need the numbers varying between 6 to 7,000 grafts in total to acquire a good coverage and the density. The patient had 4,000 grafts extracted from his donor area. Out of these 4,000 grafts, 3,000 of the number were distributed in the front side and 1,000 in the mid-scalp. The hairline was restored according to the basic or golden rule in hair restoration surgery, when we tell that the hairline most of the time should be conservative, so it should sit slightly higher and should be slightly narrow in the corners. In the pictures before the surgery, you can see that the patient had some remnants or the shades of the front hairline of his own one. So during the planning, we decided to stick up or withhold with his own hairline, reconstruct and reinforce it so it will look much more natural, will give us the chance to give the patient more coverage and the density. So you can see the result of the patient. As I told you, it's almost 20 months after the surgery. The main idea of the hair restoration surgery, as we always tell to our patients, is not to get exactly the hair that you had when you were maybe 20 years old, but to create a good outlook of the hair. So with an appropriate haircut and good styling, the hair lay on each other, creating a good outlook of the hair and restoring the front frame of the face. And you can see the picture of the patient before the surgery. You can see the wide opening in the front side, the thinning in the temples, big open area in the front side, mid-scalp, thinning and the hair loss in the crown area as well. So the patient expectation was to cover as much as possible, but the highest priority was the front and the mid-scalp area. So the planning was done the same way, and it was technically the most correct surgical approach for him. We restored the front hairline. Around 3,000 grafts were implanted in the front side, and around 1,000 in the mid-scalp and transition to the crown area. The plan was done that for the second surgery, in at least 1 year later, we will go with the crown reconstruction, but in between two surgeries, definitely we advised him to stick up with the medical treatment, basically finasteride and minoxidil. Most of the time, main question we have from the patients that which one we advise, finasteride or minoxidil. Actually, the best is to combine both of them, because finasteride, very simply speaking, is very efficient in slowing down or stopping the active hair loss due to the effect on DHT blocking. But minoxidil, yes, of course, it also slows down the hair loss, but one of its main effects is that it increases the blood flow, so giving the hair follicles more blood flow and more nutrition. One of the main aspects of the hair loss in androgenetic alopecia is the depleted or diminished blood flow, so it increases giving the hair more volume. So very simply speaking, finasteride is to stop the hair loss, minoxidil is mainly to give it more volume. And you can see here we didn't do any surgery in the crown area, but with the medical treatment, his crown area has restored pretty much of the hair, becoming slightly darker and giving him a better outlook of the hair. And we will be planning his surgery if needed on all the time for the second surgery to reinforce the crown area as well. So this is a good example of how the progressive or advanced stage of the hair loss can be treated in multiple step surgery plus the medical treatment. The medical treatment and the surgery should be done all together because they complete each other simply. So basically we always tell the patient the hair transplant surgery is needed to cover the open areas as much as possible. It's like you're playing with a puzzle, but the medical treatment is crucial aspect, especially in androgenetic alopecia, to prevent furthermore loss of your non-transplant or pre-existing hair, and it gives us the chance that the effects of the hair transplantation surgery the patient had will be much more long lasting. And one of the key questions again we get from the patient is that what we advise, the peel form or the topical form. It's an individual approach. Both of the forms can have almost the same efficacy. It depends on patient expectations, their lifestyle, or how they want to proceed, and decision is made individually. Thanks for watching. Stay tuned. If you have any questions on the go, you'll be able to ask it in the comments under the video. Take care.